Hey guys, welcome back to Film Title. Today we'll talk about the most nauseating moments on Dr. Pimple Popper. Let's head into it. Number 1. Bullied because of his neck lump. Dr. Sandrelli has always been there for her patients, and even the coronavirus epidemic couldn't keep her from doing so. Dr. Sandrelli encountered John, who had a large tumor on his neck. On the most recent episode, John said he first saw the bulge 20 years ago, and it was the size of a quarter at the time. However, it began to expand over time, and has now reached a point where it's an issue. John assumed the bulge appeared after he saw a chiropractor. He remembered putting his head in traction and hearing a click sound that made him feel like something had been taken from his body. The lump shifts out, but it puts pressure on John's neck at night, making him feel as if he can't breathe. After years of battling with it, John decided to see a doctor and have it checked out. However, the doctor said that surgery may result in his losing sensation on one side of his face. Hearing this, John decided to forego the procedure. However, as things was not improving for him, he decided it was time to seek treatment from Dr. Lee. It was tough for John to live with his condition, he said. He recalls his family members bullying him and calling him nicknames like Turkey Gobbler. It got to the point that John felt he couldn't handle it any longer. Teresa, John's wife, stated that once the lump grew in size, he had changed. She recalls John being hesitant to leave the house due to his condition. At the same time, John claimed that he hadn't seen his family in 5 years. John said that he was weary of concealing and wanted to get rid of the lump. In the hopes that no one would notice the lump, he always wore a t-shirt that covered his neck. Because of the weight, John said the bump would pull his neck down. Dr. Lee was aware of John's distress and appeared eager to assist him. However, she was well aware that things was not so straightforward. She saw that the bulge had been put near critical nerves. Dr. Lee suggested that they do some tests first to make sure she wasn't taking any chances. Number 2. Squeezing a lumpy fat mass out of a woman's bicep. One of Dr. P's most recent patients gave her a simple and gratifying pop, a welcome change from her messier treatments. Dr. P healed a woman with a lipoma, or fat lump, inside her bicep in a recent video. After injecting the area with a numbing medication off camera, chopped through the growth center with a surgical blade. The tumor was probably diagnosed as a lipoma by Dr. P. A lipoma is a fat-filled growth that develops between the muscle layer and the skin layer of a person. Lipomas usually grow slowly and are modest, with a diameter of around 2 inches. Dr. P explained in a recent video that lipomas are enclosed in a tiny sac beneath the skin surface, allowing them to pop out of the skin with one squeeze. The lumpy off-white lipoma appeared shortly after Lee's finished making the incision. She next loosened the lipoma from the patient's inner skin walls with her gloved fingers and scissors. She also pushed the lipoma to the surface by squeezing both sides of the incision with her fingertips. An amorphous mass of fat erupted out of the skin cavity soon after, though a bit of tissue kept it linked to the patient. Number 3. Infected cyst. Dr. Sandrelli revealed one of her favorite treatment videos of all time on Thursday, in which she drained the patient's orange-sized back cyst. The patient had an epidermoid cyst, which is a form of cyst that occurs when skin cells burrow and grow beneath the skin. Epidermoid cysts usually grow slowly and are not unpleasant. The cyst had turned inflammatory and purple in this case when it burst beneath the skin. Despite the fact that the cyst isn't diseased, Lee says she refers to burst cysts in this manner, since it's the simplest way to describe what's happened to patients. When an epidermoid cyst ruptures, it triggers a strong foreign body inflammatory reaction. The skin becomes warm, tender, painful, and swells, imitating an abscess. Lee recommended that the patient use a warm compress to the irritated cyst for 2 days to relieve their irritation. Lee then injected a numbing medication into the back cyst in her office. She poked the cyst with a little blade, and liquid pus and blood poured out of its center like a cascade. Lee pressed her finger above the incision she'd made, and the growth poured even more pus and blood. She exclaimed, "Gosh, it wants to come out." The cyst size began to decrease as the pus continued to drain like another 5 minutes. This treatment procedure, according to Lee, relieves pain and inflammation nearly instantly, and antibiotics aren't required after the cyst is emptied. This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so that you don't miss any of our videos in the future. Also, watch the 2 videos that are on your screen because I'm sure you'll love them. With that, I'll see you in the next video.